Now I'm going to talk about infant doll therapy and why it's so powerful for people with dementia. We recommend infant doll therapy as well as using animatronic pets or stuffed animals, which I'm going to talk about here in a little bit, for people who are moderate to late stage dementia. The reason being is that we think about the first pillar of the dementia connection model, which is retrogenesis. Research has shown that all skill sets go in reverse to infancy. Even Dr. Barry Reisberg pointed out that the developmental age of someone who's moderate to late stage could be age 7 to 4 weeks old. So if we think about what children do and how they play, they put life into their dolls, they put life into their stuffed animals, right? So that's why this intervention and using stuffed animals is so powerful with people who are moderate to late stage. Now we have to always ensure that we are using interventions with dignity and respect. So we recommend dolls that look like real babies, and we recommend pets that look like real pets, or animatronic, which we highly recommend. Now, what's great about using infant doll therapy is it provides potential auditory stimulation if the baby doll comes alive and it has sounds. It definitely provides visual stimulation, which is the most important. And thirdly, it can provide tactile stimulation, which we'll talk about why that's so powerful here in a second. Now, you could also add olfactory stimulation. What do I mean? So you can add essential oils to the baby doll, either on their clothes or if they have a bow in their hair, to provide that olfactory stimulation. And Jessica's going to go into why essential oils can be so powerful as intervention here in a little bit. So what are some benefits of infant doll therapy? So when you are stimulating them, you are also bringing about the feelings of unconditional love because they see the baby. And when they visually see the baby, that connects them to that sense of unconditional love. Research has shown that it can improve mood and decrease depression and aggression. So really important to introduce this during the 30 minutes before potential sundowning and through sundowning, because this can help minimize or maybe even eliminate the sundowning effect. It can also help with focus and concentration. This is where tactile stimulation comes into play, where when they're touching the doll, right, it generates that process of neuroplasticity. And the side benefit of neuroplasticity, which is occurring in the brain, is the side benefit of attention and concentration. So if you want them to pay attention to you, have them use an infant doll, right? It can also increase fun and enjoyment. What's also an amazing benefit is that it can improve cognitive functioning. What do I mean by that, right? Is, with all the accessories that a doll can come with, clothes, diapers, right? Bottles, blankets, the person can sort and organize and categorize these things. Maybe as if they're doing laundry for their baby doll, right? Or for their baby. So that can really provide good cognitive stimulation, which works different parts of their brain, including their frontal lobe, which helps with their executive functioning skills. Now, a couple of do's and don'ts, okay? You want to, when you're first introducing it to the person with dementia, you want to ask them to hold the baby. So you're going to bring it over to them and place that into their arms. Now, if they have some kind of scowl on their face or they push away, that means they're not interested, so don't force it. When you are handling the baby, you want to handle it as if it's a real baby. Handle it with care, right? And so when you hand it over as if you're handling a real baby, real gently. Don't hand it over like this or throw the doll, because the person with dementia is going to be confused because they think it's real. And it may actually agitate them if they see that, which that's not what we're trying to do here, right? You also want to make sure you have a place to put the baby doll, because when the person with dementia gets tired, they will feel a little frustrated if they have to keep holding the baby. So have a non-mobile carrier or a non-mobile seat for the person with dementia. They can put the baby doll there and feel that the baby doll is resting and is at peace. You also want to have lines to reassure the person with dementia, because they may say things like, I need to feed the baby, or the baby might get tired, what do I do? And you want to find lines that are going to reassure the person with dementia, saying things like, oh, she just ate, she just wants to be held, or could you try to burp her? Or things like, actually she just got up from her nap and she would love to snuggle with you right now. Those are lines that you can say to reassure them. So when you're using infant dolls, it is such a powerful intervention for so many reasons. And now we're going to talk about why pets are just as powerful.